Coming up on today's episode of The Health Review.
So there's a lot of things that women can potentially go through with regards to their intimate health. On the positive side, they don't have to suffer with these issues. There are things we can do. I've had women come in saying they can't wear jeans, they can't wear tights, some of them can't even wear underwear. Having issues with your vulva can also affect your intimacy.
Hello, welcome back to the Health Review. Thank you for joining once again. Today, we're talking about something very interesting, something that I think we all need to hear more about, a topic that's often a little bit taboo. So we're going to be talking about a part of women's health that's still far too often ignored, and that's the intimate health area. From painful sex to vaginal dryness, everything else in between. We're going to have a big discussion about this today, and my guest is Dr Shirin Lakhani, a trained GP, menopause and women's health specialist, and the founder of Elite Aesthetics. She's appeared on This Morning, Embarrassing Bodies, and the BBC, and is known for breaking taboos around vulval and vaginal health. We're going to talk about lots of different things today, including what's normal, what's not normal when it comes to vaginal health, the role of the microbiome, and why pain during sex is more common than people realise. So many questions to ask you today, Shirin. Thank you for coming on the Health Review.
Oh, thank you so much for inviting me, Emily.
I'm loving this because it does feel like a taboo topic. I've seen some of your interviews. You've been on national TV, breaking these taboos, making it more normal for women to have these types of conversations because pain in that area, symptoms, it's normal, right? It happens at various points in people's lives, for women, especially after menopause, which we'll go into. But I'm curious, what made you feel so passionate about women's health and vulval health in particular?
I think particularly with my background as a GP, seeing women come in, firstly being embarrassed to talk about their symptoms, and then when they finally pluck up the courage to talk about what's going on with them, they were often dismissed or told that it's just part of life, it's part of being a woman. And seeing them suffer in silence just really got to me. There's a lot of misdiagnosis around vulval health as well. And I see women come into my practice who would have pain on intercourse or involuntary vaginal spasm during intercourse. And they were told to have a glass of wine and relax a bit more. And things weren't taken seriously, and these women would go on to suffer. So it made me more determined to open up the conversations around intimate health so that women could feel empowered to come forward.
It's so important, and I guess it's linked to so many things. I guess confidence, obviously it can be uncomfortable, but also if it stops you from being able to have intercourse with your partner, that can have a really kind of damaging effect to your relationship and all sorts of things. So it's a really important topic, and I'm really glad that you're discussing it. Was there like one experience or event that happened that made you think, right, this is an area where I need to specialise?
It's a tricky one. So before I became a GP, I used to be an anaesthetist, and I used to do a lot of gynecological anaesthesia. So I'd see women coming in for procedures like TVTs, which are transvaginal tapes for incontinence. And it was like a conveyor belt. It would be one in, one out, getting these procedures done. And I thought there has to be a better way than this. And a few years later, I came across PRP, which is platelet-rich plasma. And Dr. Runnels in the States had developed the treatment called the O-shot. And with an injection of your own blood product, you could actually treat things like stress incontinence without the need for surgery. So that opened my eyes to a whole new way of doing things. And once I started talking about the procedures and the problems, it was astonishing how many women came forward. I thought it would be for incontinence, but the number of young women who came forward with things like sexual dysfunction, inability to orgasm, pain on intercourse just blew me away because these things weren't talked about. I think where women felt there weren't any solutions, there wasn't any point in raising them. So that's kind of motivated me to keep going and develop more treatments.
That's great. And you mentioned some of the, I guess, conditions and symptoms that women have come to you with. But what are some of the most common that women might experience at different stages in their life?
Women can have issues throughout their lives with intimate health issues. At puberty, you get things like painful periods, heavy bleeding, problems with your cycle. As you go through to childbirth, then you can get problems with stress urinary incontinence, vaginal laxity, loss of sensation. And then as you age even more and go through menopause, those conditions can get worse. And you also get issues with vaginal dryness and irritation, loss of libido. So there's a lot of things that women can potentially go through with regards to their intimate health. On the positive side, they don't have to suffer with these issues. There are things we can do.
That's great. And you opened Elite Aesthetics, which offers a wide range of treatments available for women who are suffering some of these symptoms or many of these symptoms that you've mentioned. What kind of treatments are on offer? Because these are some of the things I've seen you talk about on things like This Morning, TV shows, where I think you did a live treatment for a brave volunteer guest. And actually she was very relaxed and said it was very, chilled, and she was happy.
I think the most important thing is to be open with patients and make them feel like actually it's okay to talk about the issues they're having. And I find that a lot of my patients, I treat men and women for intimate health issues, come in and they're nervous, but once they realise that actually I'm not embarrassed, they tend to relax and open up more. So I think that's really important as someone practising in this area, to be open and honest with your patients as well. So with Elite Aesthetics, alongside your routine aesthetic treatments, we've got a specialist interest in intimate health. So we have a range of treatments available that can help men and women with their concerns. So talking about the women's issues in particular, I've got energy-based devices, we've got regenerative treatments, we've got injectables that can all help in different ways. So if, for example, we're talking about vaginal dryness and menopausal atrophy, as well as the things you can get over the counter and things you can get from your GP, we've got revolutionary treatments like PRP, so the O shot, which helps stimulate your own collagen and elastin and helps natural lubrication and improve sensitivity in the area. There's another treatment called radiofrequency microneedling. Now, many of your listeners may have heard of Morpheus 8, and the company behind Morpheus 8 have made a device called Empower RF, which has got technologies to help treat all sorts of women's health concerns. They've got radiofrequency and radiofrequency microneedling to address the collagen stimulation side of things. They've also got electrical muscle stimulation to help with pelvic floor function as well. So with all these different modalities, you can address pretty much whatever comes through the door.
Wow, that's so fascinating. And I think pelvic floor is something we all need to focus on. We did an episode previously about pelvic function and how a lot of women, after having children in particular, suffer with problems in that area, and it can be so debilitating and just stressful, and the anxiety that women go through if it's not dealt with. And knowing that there are other things you can do as well as your own exercises is brilliant. I'm curious with the collagen one, what would that help?
So that helps with blood flow to the area. It helps with strengthening the vaginal tissue as well. We talk about the pelvic floor muscles quite a lot, but what we don't realise is that the vaginal walls also have a supportive function. So they help hold the pelvic organs in place. So with ageing and with childbirth, you get thinning and deterioration of that tissue. So by stimulating the body's collagen and elastin, you can help improve the quality of the tissue and put that support back.
And for people who have pain during intercourse, I guess at any age that can be, what causes that? Do we know?
There are many, many things that can cause pain during intercourse. And the important thing to say is that if you are suffering with pain during sex, don't put up with it. Go and get a diagnosis, because the treatment depends on the cause. So the cause can be things like hormonal changes, pelvic muscle dysfunction. Some people have an over-tight pelvic floor. And then there can also be conditions like vaginal atrophy and a skin condition called lichen sclerosis. And then there's conditions like endometriosis and adenomyosis, which can lead to pain during intercourse, as well as infections. So it's really important to know what you're treating before you go and have treatment. In terms of treatments, they can range from HRT, either systemic or localized. Some of the treatments we've already discussed, moisturizers, lubricants, and if it's endometriosis, then you may need to have surgery as well.
And you mentioned there lichen sclerosis, which I think Is that, did I pronounce it properly?
Lichen sclerosis.
Oh, yes, lichen sclerosis. There we go. Is it quite common?
The statistics say around 1% of women suffer from it. I see quite a lot of it in my clinic, so I think my view on it is slightly skewed because it seems incredibly common to me. There's a few things I want to say about lichen sclerosis or LS. Firstly, it not only affects postmenopausal women, it can affect women of any age. It also can affect men as well. It's much less common in men than women, which is why we often talk about female lichen sclerosis. But the issue with that is it's poorly understood, and often it's not even recognised by medical practitioners. So people go for many, many years being diagnosed as having recurrent thrush. And often by the time I see patients with LS, they're quite late on in their progression. So they may have scarring, they may have fusion, which is where the tissue sticks together. You can get narrowing of the vagina, and the whole midline can stick together as well. So it can be quite debilitating if it gets to that stage. I've had women who can't have intercourse either because of the narrowing or because of the pain and the tearing they get with it. I've had women come in saying they can't wear jeans, they can't wear tights, some of them can't even wear underwear. And as we've already mentioned, having issues with your vulva can also affect your intimacy. So it affects your relationship with your partner as well.
And I guess also, like, if you're younger and you want to have children, having to face that to be able to have intercourse, but then also childbirth, like, does that mean you shouldn't really have a natural birth?
Some women can successfully have a natural birth if they've got LS. Others have to have a cesarean section. It depends on the degree of the scarring. But just because you've got LS doesn't mean you can't live a normal life. On the NHS, women are prescribed steroids to control their symptoms. There are lots of things you can do to keep the quality of the skin healthy. So I often recommend localised estrogen cream, even in my younger patients, because it helps strengthen the quality of the tissue. I also recommend moisturisers, unscented ones. It's up to the person to find what's comfortable for them. And then I've had some incredible results with both PRP and with radiofrequency microneedling at improving the condition of my women. We talked about pregnancy. I've actually had some of my patients who weren't able to have intercourse who've gone on to have children after treatment.
Oh, that's so great to hear, yeah. And I'm guessing also for women who have tightness, that's quite common, isn't it? It's a different condition, but for women who, I guess, is it like a cramping sensation if they try to have intercourse that can be quite traumatic for them as well?
So that's called vaginismus. And again, it's not very well understood because I think you'll see the general trend is there isn't a lot of research in women's health issues, particularly when it comes to their intimate health. So with vaginismus, it's an involuntary spasm of the muscles when the woman's trying to have penetrative either sex or with a toy, and it stops penetration. This was one of the conditions that was often dismissed as frivolous, and women were told to have psychosexual counselling or have a glass of wine to relax. Other women who've experienced pain of intercourse were prescribed local anaesthetic creams. And that's to disguise the pain so that their partner can penetrate. What's the fun in that for the woman? It's not addressing the actual issue. So I think our attitudes to women's health needs to change. With vaginismus, often there is underlying pain that hasn't been dealt with, and then that instills a fear of penetration as well. There are treatments. You can use botulinum toxin, so Botox, to treat the muscles and relax them, to enable penetration to happen. So again, it's not something that needs to be put up with.
Do we know what causes it? Because I've heard like people say they're told often that it's like a mental thing and that they need to like do meditation or go and see a therapist, as you say. Is there like a physical cause that we know about?
There may have been something that precipitated it, and that can be different for different women. I mean, for example, sexual trauma in the past, pain, infections may precipitate it. But again, it's one of those really poorly researched conditions, so we don't have enough information.
It's so crazy, isn't it, to think that we've got this far and only now are these conditions just being spoken about. Like, I haven't heard many people like yourself speaking in the press on TV, on podcasts. I think when it comes to, intimate health, there's still a long way to go. We're at the very beginning. Do we know if there's been any advancements with things like studies? Because you're mentioning that actually it's so poorly studied up until this point.
I think things are beginning to change. We are becoming more vocal. Women are beginning to speak up a bit more. It's more common with things like endometriosis and menopause. But again, there's still stigma and taboo around vulvas and vaginas. And people can't even say the words. They're too embarrassed. You make up silly names for the vulva. And that's something I'm trying to change, because actually own the language, break down the taboos, and it will encourage more women to come forward. There isn't a huge amount, from what I've seen, of research going on for vulval health, but it is starting. And I'm seeing smaller studies beginning to be published, particularly around some of these new treatments that are available. I think there's still a really long way to go, though.
I had Dr. Nikita Kanani, who on the show recently, and she was obviously the former head of primary care for NHS England. So she's sort of seen people in the community, but also been sort of, on the policy side of things as well. And she was saying that she felt that actually a lot of the progression that's happened in women's health has been because women are educating themselves more, and they are advocating for themselves more, and they're showing up to their GPs more and saying, look, I think I might have endometriosis. Like, I'm not leaving until I get a referral or whatever it is, which is great. But also, obviously, we know that the system still needs to catch up. But it's great that women are, advocating for themselves more through education, through communication. But perhaps with this area, women don't have the education yet to show up in that way that they are for endometriosis, for heavy periods. When it's things like vulval health, I feel like most people don't really know what to look out for.
It's funny you say that, because I've recently launched a campaign called Check Your Vulva. And the whole point of that campaign is to teach women the correct terminology, to know their anatomy, to start examining themselves regularly so they know what's normal for them. And then they can pick up when something changes and advocate for themselves and actually go and seek help early. Because with a lot of the conditions we talk about, early diagnosis and early treatment is essential to prevent the disease progressing. And particularly with things like lichen sclerosis or vulval cancer, the earlier you pick it up, the better. We made up some mirrors that we handed out that say, check your vulva. We've had a couple of events to talk about it. And it's really about breaking down the stigma about talking about your vulva and your vagina. For example, I said this the other day, if you've got a pain somewhere else in your body, you're not embarrassed to go to your doctor and say, I've hurt my elbow, or I've hurt my ankle, or I've got an itchy ear. So if you've got an issue with your vulva, you should be able to go in and say, I have a problem with my vulva, and not be embarrassed and go, oh, down there, or with my mini. And I think it's important to teach young girls the correct terminology, and boys as well, because the correct language takes away the stigma around it.
Yeah, that's a really good point. And what are some of the key things that are in that campaign that people should be aware of and maybe start thinking about?
So we've normalised checking your breasts. So this is about normalising checking your vulva at the same time, and just starting to do it once a month. With a mirror, also have a feel as well, because you want to look out for lumps or textural changes. I see a lot of women with quite significant scarring down the line, and I say, how long have you had this? And they don't even know something's wrong because they've never checked. It just doesn't feel right, but they haven't ever looked to see what's going on. So I think we need to change that and have teach our teenagers to start checking themselves, so that when things do change as they get older, they can pick it up quicker. I mean, I've always been open with my two daughters about vulvas and periods and all sorts of things, to the point where I got told off by a primary school teacher because my daughter said vulva in class. And this was many years ago. My children are grown up now.
Yeah, that's crazy.
Yeah, and I said, well, actually, she's using the correct terminology. You're the one who's not.
Yeah, I mean, I don't know what the teacher
little
would
bottom or
no
things. It's like, no, don't create that stigma around it from a young age. I remember my daughter, when she was 2, saw me changing my sanitary towel and said, why are you bleeding? And I explained to her what periods were at that age because she asked, and I didn't want to make anything up. And I think the more open we are with our younger generations, the quicker we'll see change come about, because they won't put up with what we've had to.
Absolutely. And I think it's so important. It starts from a young age. And it has been this hugely sort of taboo thing, which I guess over the generations has faded a bit. I would say, I mean, I went to like dance schools and stuff. So I feel we were all in the changing room. Everyone was very open about their periods. And it was kind of a different environment to, I think, a lot of women and what they would have experienced. So but I know looking back to like, you know, parents' generations, these things were, I mean, extremely taboo. Like you would never have spoken to your friends about, oh, I've got a pain down there, or, you know, I can't have intercourse anymore, whatever it is.
Well, they wouldn't even speak about hot flashes and night sweats, would they? So I think we've come a long way from that. The thing is, though, I mean, we're more open about menopausal symptoms now. And like my friends and I joke about having a hot flash or having a bit of brain fog. We're all accepting that we're going through the changes and these symptoms are common. They don't need to be put up with, but they are common and it happens to all of us. But we still don't talk about the genitourinary side of menopause. The thing with hot flashes and sweats and anxiety, all of that tends to improve as you go through your menopause, as the hormones settle down. But the genital changes are progressive. So unless you treat them, they're going to get worse and worse. So it's really important that we raise awareness, because the surveys show that between 50 and 70% of women will suffer with things like vaginal dryness or urinary symptoms or recurrent infections. And only about 14% of them will bring it up with a healthcare practitioner. So
that's so sad. That's a horrible statistic. And what's the sort of first line treatment? I've heard that vaginal pessaries during this perimenopause stage can be very helpful.
It's not just pessaries. There are different ways you could administer vaginal estrogen. One thing that keeps doing the rounds is that estrogen gives you breast cancer, HRT gives you breast cancer. But with vaginal estrogen, it's such a low dose and the absorption is so low that it is generally considered safe for most women. And even breast cancer survivors have been prescribed vaginal estrogen. So I know the FDA are talking about removing the black box warnings on vaginal estrogen that says that it causes breast cancer. I think the MHRA should move towards doing the same, because a lot of women still fear what's written in the leaflet. And actually that relates to systemic old-fashioned HRT rather than the newer bioidentical, body-identical things we're using now. And it's been shown repeatedly that actually low-dose vaginal estrogen is not going to increase your risks.
That's really good to know, because, there was a lot of, I guess, miscommunication, misinformation about the Women's Health Initiative study. We've brought it up on the show quite a few times. So it's good to know that it's starting to change, but you do still hear of women who are still not being prescribed estrogen from their doctors, or HRT. But I guess what you're saying is if you've got symptoms in that area, it can be safe for most people.
With systemic HRT, it's a higher dose and you take it via a patch or a cream or tablets. When you're using vaginal estrogen, or now there's vaginal DHEA as well, the absorption into your bloodstream is low and it acts locally and it improves the local situation. So if you're taking estrogen systemically and you have a womb, you're told to take progesterone alongside it to protect the lining of the womb and prevent endometrial cancer. But if you're taking a vaginal estrogen on its own, you don't need to take the progesterone with it because the absorption's low. Yeah.
Okay, that makes sense. And how important do you think for women like diet and lifestyle is as well? Because there are studies that have come out now about the vaginal microbiome being important. We know that certain strains, I think it's Lactobacillus crispatus or something, is really good for fertility, and it can help your chances of a successful implantation. There are now pessaries, plus you can take probiotics. So it's exciting that things are moving in this direction. What do we know about the microbiome and the vagina, but also like what dietary things might help?
The vaginal microbiome is really important and it's really delicate. It prevents infections and it maintains a healthy pH. So it's the good bacteria living in your vagina that prevents overgrowth of bad bacteria and fungi. So if you disrupt that microbiome, you're much more likely to get things like thrush and UTIs. It is, like you said, mainly lactobacilli species that live down there, but there are lots of things that can disrupt the microbiome. So things like harsh chemicals, perfumed washes, douching, antibiotics, stress, hormonal changes, that can all cause a change in the genital balance that we've got in our vaginas. So in terms of lifestyle things, taking probiotics, particularly if you've had to take antibiotics for anything or you're undergoing stress, using hormones if you need to, and also doing things like sleeping well, eating healthy food, eating prebiotic foods like garlic or leafy greens or oats, that can all help. Avoiding tight synthetic clothing. Obviously, if you want to wear nice underwear, sometimes that's fine, but most of the time you should be wearing natural fibres. Other things you can do in terms of lifestyle, not smoking, maintaining a healthy weight, that can all help.
That's great. Yeah. Getting that balance right can be really important for that area. And I think not enough, I guess, GPs, I don't want to say all GPs, because I know that a lot of GPs are changing their methods and their communication and they're really paying attention. But I mean, definitely when I previously went to the GP with issues like this, there was no discussion about what's your diet like? Are you drinking? And as you say, I mean, I used to get UTIs, and I've also mentioned this on the show several times, but I used to get chronic UTIs. I had to see a urologist, had a few different procedures even to try and make things better for me. And actually, when I said, look, everything you've done hasn't worked, I keep going on antibiotics, keeps coming back, you know, everyth's miserable and I'm really sad, I'm going to stop drinking and I'm just going to do all these things and see how it goes. And the consultant urologist just said, like, why would you do that? Just a glass of wine a day could help you unwind, relax. Why would you get rid of that when actually that will help you relax? And I was like, this is crazy. So I feel very passionately about...
I think it's difficult, isn't it? Because medical education hasn't included lifestyle medicine historically, and that's something that if you're interested in, you have to go and learn about all by yourself. I think that's going to change, but the NHS has been focused on treatment rather than prevention. And I think with our growing ageing population, we need to be looking at more preventative medicine in all aspects. And as you said, lifestyle and diet make a big difference. So cutting out refined sugars is one really big thing you can do for many, many illnesses.
And back to your clinic, I know that you've pioneered, so we mentioned earlier the O shot and the P shot. For those who, I mean, you've mentioned them briefly, but could we go into more detail for those who don't know what they actually are, what they could help? Is it an aesthetic thing or is it more treating a specific condition?
It is functional treatments. So the O shot and the P shot are both PRP treatments. The O shot's for women and the P shot's for men. So that's the difference between the two. But what they do is they use your platelets from your blood to regenerate tissue. And depending on where you inject the PRP, you can regenerate the tissue in that area. So for the P shot, we're injecting the penis, and it's great for things like erectile dysfunction, Peyronie's disease. And
what's that?
So Peyronie's disease is where you get plaques in the penis and they can cause bending of the penis. It can be due to trauma, or it can be due to things like diabetes and other conditions that cause reduced blood flow into the penis. So depending on the degree of the bend, it can be painful for the man to have penetrative intercourse. And in some cases, they may not be able to straighten their penis enough to penetrate either. So again, these conditions can be quite debilitating for the patient. We've talked about some of the women's health concerns that brings them in for treatment. So things like vaginal dryness, urinary incontinence, pain on intercourse, reduced sensation, reduced lubrication, and lichen sclerosis. So all of these conditions can be helped by PRP. The way I like to explain it to my patients is when you cut yourself and you bleed, and then you get a yellow goo, and then you have a scab, and then over time the tissue heals and it's like you hadn't done anything. In the same way, we trick the body into thinking there's been there's been an injury in the area we want to regenerate. So for the vagina, we trick the body into thinking there's been an injury there. So it sends in all the healing factors and it repairs whatever chronic damage there is there. So it improves the blood flow to the area. It can stimulate new nerve growth. It improves lubrication. It stimulates collagen and elastin.
Okay, wow. And what's it like as a customer? Is it painful?
No,
is it
everyone always asks
uncomfortable?
that. It can be a little bit uncomfortable, particularly for my lichen sclerosis patients, because they have to have a bit more of an extensive treatment. The standard dose shot for vaginal atrophy and sexual dysfunction involves 2 injections, and we use numbing as well, so it's really comfortable. For the lichen patients, they tend to have extensive external treatment. That's a little bit more prickly, but everyone tolerates it.
And what kind of results can you expect from, I don't know how many of these treatments you would need, I guess, dependent on what condition you're coming with?
Yeah, so the results vary because it's a regenerative treatment. It depends on your healing capacity as to how good your individual results are. Mm-hmm. But they're meaningful results that you can get from them. So as I've said, I've had women who've come in for treatment who weren't able to have penetrative sex before, who then went on to have pregnancies. I've had patients who come in regularly and tell me they can wear jeans again, which I haven't been able to do for ages, and I do my little dance.
That's great.
And the majority of them come in and they say, I'm not focused on my problem anymore. I can actually just get on with life. Mm. Because when you've got an issue, if you've got incontinence and you're constantly planning your day around where you're going to be able to go to the loo, or you're so uncomfortable that you think, I can't walk extensive distances, I can't go on a hike, I can't even walk down to the shops without being uncomfortable. These are things before you even get to the intimate side of things that are daily lifestyle things. And you sit there focused on your condition and you don't appreciate the rest of life because you're so tunnel visioned with it. So when they come in and say, actually, I'm not thinking about it anymore, it's not a big deal for me anymore.
That must be so nice for you, because I think it's just one of those things that makes you really realize when I'm speaking to you, I'm thinking about how so many people are going through things that you just would never know. Like you wouldn't know that someone potentially could be going through incontinence, and it's an invisible, I guess, illness or symptom that they're going through. And it just shows you that we were all very private about these things. And it's great that clinics like yours are offering these types of non-surgical treatments, which hopefully are, less invasive and still getting good results. There is also an aesthetic market now for this region, particularly for women. The vaginoplasty, is it
labiaplasty?
Labiaplasty.
Yeah. I mean, that's been around for a really long time, much longer than the regenerative treatments have been around. When I first started offering the functional treatments, they get labelled as designer vagina treatments. I think you're always going to have that market there, especially where all you see in terms of images of vulvas are what's in porn or what's in men's magazines. And I try and educate my patients that actually vulvas are like fingerprints. No two are the same. They're all unique, just like our faces. They're not symmetrical. The labia aren't identical to each other. Unless it's actually causing you issues, whether it's psychological issues or physical issues, I tend to teach my patients to accept their bodies the way they are. But obviously, if it's something that really concerns you, affects your confidence, then that's your right as a woman to seek out those treatments.
It's been a bit of a trend, hasn't it? Recently, people are talking about it more. But what treatments are people going for the aesthetic side of things?
Even the patients looking for aesthetic treatments tend to be looking for them for functional reasons.
Really? That's interesting.
And I don't see many women coming in just because they don't like the look of their vulvas. They are coming in because, for example, maybe the labia minora are interfering with what they're wearing, going to the gym, interfering with intercourse, or they've lost a lot of volume in their labia majora and they're getting what I call exposure symptoms, so irritation, itching, dryness. So even the ones who come in looking for what we traditionally call aesthetic solutions are usually doing it because there's a functional issue.
That's really good to hear, because I was concerned you were going to say that you're getting inquiries all the time of women who want Botox and fillers down there just to make things look better without really a functional sort of side to it. Because it does feel like there's a lot of pressure on women to be perfect from head to toe. And it doesn't surprise me that over the years there have been women getting the equivalent of a facelift down there, which just seems a bit extreme to do.
And like I said, I like to teach my patients. I've actually got a screensaver that's a wall of vulvas, and it's got lots of different types of vulvas. So I show my patients that, because a lot of them that come in wanting a physical change in the appearance, often it's because they don't think theirs looks normal. And when you show women what a range of normal vulvas looks like, that tends to reassure them. The other side of it is where you get someone coming in because they've been put down by a man. And I tend to say to them, well, that's a him problem, not a you problem. And it's usually an ex-boyfriend that's had an impact on their psychology.
That's so sad. How evil.
It is. But, I mean, we as women don't tend to comment on the appearance of men's penises.
So things like facials down there, like
Avoid.
Yeah.
Avoid.
Why avoid? What?
Because as we've already talked about, you've got a really delicate microbiome in your vagina, and vajacials, as they were called, or vajazzling as well. You're going to introduce foreign material, perfume, creams, etc., which you do not need in your vulva.
Vajazzle, oh my God, that brings back, that was a trend for a
was a
while, the
trend.
gemstone. When was that?
Oh gosh, when was that?
That was a long time ago.
I think it was the early noughties.
Yeah, so what was the trend there? It was basically like
Glitter and gemstones, wasn't it?
How weird. The world is weird. Let's hope they never come back, because it feels like the 90s fashion has been back recently. So let's hope the vajazzles are not the next thing. In terms of women's health going forward, what do you hope is going to happen in the next sort of 5 to 10 years when it comes to intimate health?
Well, if I could wave my magic wand, all the treatments I offer would be available on the NHS to every woman who needs them. But realistically, that's not going to happen. I want more education amongst healthcare providers, so that they know what conditions exist. And I don't want to keep hearing from my patients that they've been told to take repeat thrush medication for conditions like lichen sclerosis. So I want there to be better diagnosis, better treatments available. I would love for everyone to be able to talk openly about their intimate health without any stigma or shame around it, because that's going to empower us to seek help when we need it and not be embarrassed. I'd also like to see pelvic floor exercises introduced into the school curriculum for boys and girls, because we've talked about the importance of pelvic floor for women, but we don't really talk about how important it is for men, particularly later on in life when they start having issues with their prostates or with erectile function, because actually that muscle helps with blood flow to the whole area as well.
And in terms of red flag symptoms that women just should never ignore, what are they?
Okay, so one of the big ones is abnormal bleeding. So any bleeding after menopause or after intercourse or in between periods needs to be investigated. Changes in your discharge that are persistent, pain on intercourse, because as we said, there's a lot of things that can cause it, so you need to have a diagnosis to find out what's going on. Any itching, discharge, any lumps, etc., that don't get better, it's better to get it checked.
And from a hygiene perspective, there was always the debate. Obviously, you mentioned that those feminine washes, I guess, they had a big moment, I guess, in the noughties as well, where everyone was told in the ads that you weren't fresh down there, you weren't clean unless you were using the specific brand, which I won't mention, but everyone was buying it, and that was a big thing. What is a safe way to keep things clean? Because I've heard that the vagina actually self-cleans.
Absolutely. You don't need to put any products. Yeah, just use water for your vagina and your vulva. If you really, really feel like you have to use something, then a gentle pH balanced, unperfumed wash. But even with that, I tend to say try and avoid it. Just water and don't douche.
I always like asking my guests to keep themselves well from head to toe, mind, body. What are the things that you like to incorporate into your routine? Are there any like non-negotiables?
For me, getting enough sleep is really, really important, because if I don't, I can get really ratty. I walk my dog at least 4 times a week, and just being outdoors with him and spending time with him is really good for my mental health. People talk about meditation, things. I tend to find I do that when I'm out walking him, because it's just me and him and nature, which is lovely. And also I like doing things that bring me joy. So I like spending time with my family and my friends, going out for nice meals, just remembering to take care of myself and enjoy myself.
I feel like people underestimate that, the connection thing, like being with friends and family, and how that's such a big sort of factor of overall health, isn't it?
Yeah, absolutely. I think it's really more important in today's day and age where everything is virtual and meetings happen virtually. You just sit there FaceTiming rather than going to see people. You make your connections online. So I think in that society, we're seeing much more in terms of anxiety and depression. So it is really important to have that physical face-to-face contact with people.
And I'm guessing your daughters, they've got a great role model from you. So I guess for them, they're used to having a lot of communication about these topics. But for girls, you know, in their generation, their age, in terms of communication with each other, so when we're seeing our friends and family, if someone's going through an issue, are you hopeful that through like conversations like this, women might feel a bit more comfortable about talking about any issues they're going through?
I'm hoping that by highlighting how common all the issues are, women will start to feel that they're not the only one going through it. Often when I've done panel discussions and things and we bring up the statistics of how many women are suffering, for example, with incontinence, I'll say 1 in 3 women have an issue, and that's an underestimate. And then we'll look and there'll be a panel of 6. I was like, well, that's at least 2 of us sitting on this panel.
That's crazy. Yeah.
And that's not including the people in the room. So I think just educating our girls that these things are common, they don't need to be put up with. And by breaking down the social stigma around intimate health, hopefully it'll encourage them to at least speak to each other about any concerns.
And I feel like starting young is so important, because it's having that awareness. Because I guess if you end up having children, you have children, which can be a huge strain in that area. Plus, then you've got perimenopause beginning. It's a lot of change in actually quite a short, especially as women are having children later. If you're having children in your 30s and you start to hit perimenopause in your, say, early 40s, that's a huge amount of change. A lot can happen. And if you don't have support around you, you know, maybe if you've got friends who are also going through perimenopause and you can talk about these symptoms together and encourage each other to go and get help, it's just a much healthier way of dealing with this, I think, than what's happened previously. So fingers crossed it will keep moving in that direction. And obviously you're doing fantastic work on raising awareness.
Thank you.
Good luck with your campaign that's happening. For anyone, Dr. Shirin, who wants to come and speak to you, has heard this podcast, thinks, actually, I'd love to book in an appointment or have a chat with you, where can they find you?
So the easiest way is to contact my clinic, Elite Aesthetics. That's on elite-aesthetics.co.uk. I'm also on Instagram as Dr Shirin Lakhani.
And Elite Aesthetics, where's it based for people who...
It's in Greenhithe in Kent. It sounds like a million miles away, but it's 20 minutes by train from St Pancras, so it's not too bad.
Yeah, that's great. Dr. Shirin, thank you so much for coming on the Health Review. I've loved this chat. I feel like I've learned so much, and I hope everyone else at home has too. Thank you.
Thank you, Emily.